Happy Friday, everyone. It is Friday, February 12th, 2021, and welcome to the SADS Foundation Facebook Live episode number 51. We celebrated the half-century number last week, so I'm so glad you could join us this week. I'm Mike Ackerman, genetic cardiologist at the Mayo Clinic in Rochester, Minnesota, and director of the Winland Smith Rice Genetic Heart Rhythm Clinic. I also have had the privilege of serving as the president of the board of the Sudden Arrhythmia Death Syndrome Foundation, the SADS Foundation, for many years now. And on behalf of Alice Laura, the CEO of the SADS Foundation, thanks for joining us again. This has been quite special to have this time together for almost a year. We've almost celebrated our first anniversary since starting this. And some of you are coming online, Carrie from Virginia. Good afternoon, and to those down under, good morning. I've been following down under closely because the Australian Open is going on, and they just did a shutdown in what part of Australia? I forget the name. Where Melbourne is, that state, which has shut down and gone into quarantine. But the Australian Open is still going on, and Rafa is still in the running, so go Nadal. But today, this is going to be really fun in a few minutes to bring on three wonderful people to hear their stories, to see what they've been busy about now and in the past, to bring about more awareness for SADS-related conditions. And they've been incredible volunteers to the SADS Foundation. Beautiful stories. They're beautiful people, and I'm looking forward to bringing them to you, because we are in National Heart Month. So in the United States, February is Heart Month. Last Friday was Red Friday, or Go Red, and I was in red. I'm colorblind, but I'm pretty sure I'm not wearing a red sweater today. So we'll get to them real soon. Just a reminder, I was encouraged by this picture today. I'll show you that. Remember, we're kind of finally coming down. I've showed you this from time to time, where we have been right there now, and we've registered one of our lowest numbers of cases per day. We were at 105,000 COVID cases yesterday. The highest ever in the United States was on January 2nd, over 300,000 cases. Worldwide, we have 108 million COVID-19 cases documented. We're approaching 2.4 million deaths, tragically. The United States, 27.4 million documented cases. Great news, 48 million documented vaccinations of vaccinated individuals. We're now 11 million more individuals in the United States received the vaccine in this past week. More good news is we know that the case fatality rate from SARS-CoV-2, COVID-19 continues to drop. Here at Mayo Clinic, we're less than 1%, 0.7% case fatality rate. So more and more healthcare programs are figuring out how to most effectively treat this if you've got it and if you've got it bad. Remember, the highest risk of getting COVID-19 and having it badly in you is older age. Can't control that. And weight. We can control that. So again, our New Year encouragement, if you need to get pounds off, great reason to get it off. And now another reason, COVID-19 is unkind to those who are obese. So that's the COVID-19 update. And now, more importantly, our topic of the day is to have you meet chat with three wonderful volunteers. And so I'm going to first have Erin bring on Danielle Mandundo and her stepmother, Karen, and have you get to know them. Well, there they are.
Hi.
Well, Danielle and Karen, welcome to SADS Facebook Live. And thanks so much for all that you've done for the SADS Foundation in the past, and all that you're going to continue to do. And before we talk about what you've been doing, give a sneak peek into your family's heart journey and how SADS Foundation has become quite relevant and important to you and your family. Danielle, you want to start and let people know who you are and what your story has been so far?
Absolutely. So I'll kind of start a little bit with my story, and we'll end up backtracking a little to get a kind of full picture. And that's why I have my stepmom here, because I was 19 when I was diagnosed. So I was a little head in the sand and not too wanting to be too compliant. So thank goodness for this one right here, who was able to connect with SADS Foundation. But when I was 19, my maternal uncle was going in for a routine test, and they happened to catch prolonged QT on his ECG. When they did that, they said that this can be genetic, and they just advised everybody in the family to get tested or to get an EKG. So with that, kind of a big group text message went out to the whole family. And, with that, Mama Bear here got me into the doctor, I think like next day for my ECG, came back prolonged. And from there, I ended up, long story short, did end up on beta blockers and with an ICD at the age of 19. I can have, if you want to kind of a little bit about that time and how some red flags and things like that, I think that you'd be a good person to take over with that part of it.
Yeah, so Mama Bear, we'll have you jump in and take over, Karen. So what else?
Well, so interesting. I mean, her memory is that I had her in the next day. It actually took several weeks for me to convince a stubborn 19-year-old to go get checked. So anyway, so she finally did. We ended up having 3 different consults with 3 different electrophysiologists. And the tiebreaker was that she should have the ICD as well as the beta blockers. So, but in the course of all that, the EPs that she saw, a couple of them said, I admit I see old people. This was 2003. So they said, I see old people. I've heard of this thing, but I don't really know. Let me reach out to some other people. So it was pretty clear to me, wow, even the super specialists aren't sure about this thing. So let me see what I can figure out. So I went on the internet back in 2003. All that was on there was basically either 2 things, either research study materials, which I had no idea what any of that meant, or SADS Foundation. And I was afraid of the name of the foundation, honestly, at first, because I didn't even want to go there or think about that. But I'm so grateful as I looked into the information that they had there. It helped me to understand it better, to convey to Danielle and other family members, so that we would make the appropriate choices. I mean, I needed to get my head out of the sand too and realize the potential seriousness of all this. So
Karen and Danielle, your stepmom Danielle mentioned 2003. So I did some fancy math quick, so I kind of know how old you are now.
Yeah.
But in 2002, that was the first year that genetic testing became clinically available in the United States as a clinical test that I could order. And so do you and your family, did you know early at that time what genetic flavor of long QT syndrome you were when you got the defibrillator, or did that come later?
Came later. So what happened was, and tell me if I'm missing parts, because again, I was young, but from my understanding is at that point, it was just the abnormal ECG. And now we know this not to be true, but at that point, because I had my mother pass away from this, they took that into consideration when deciding whether or not to put in an ICD. They put that as a higher risk factor, which we now know isn't the case, but at that point they utilized that along with the length of my QTC, which was very long. So those 2 pieces, I had 2 out of 3 markers. And with that being said, they placed the ICD, didn't know what type. And kind of no one really talked to me too much about genetic testing until when I was 24, pregnant with my first daughter. And that's when I kicked into Mama Bear mode. And I'm like, now I need to know. And in 2008, I was genetically tested or screened because I was the first one in my family. And it was type 2.
Okay. So you're an LQT2 family, and and you mentioned your mother's tragic death. How old was she, and how old were you when that happened?
Yep. So I was 3 months old. She was 18. So it was postpartum. She was diagnosed with epilepsy. She became symptomatic at age 9, right around when she started having some puberty, and was very symptomatic.
Wow.
So she was very symptomatic. From talking to my grandparents, symptoms, again, around puberty, times when she was, on crazy rides at the fair. That's when they would worry that she would potentially, have a seizure, things like that. But she was not diagnosed. She, again, was on, anti-seizure medication, and that was it. The only reason we can look back now and say, this makes sense.
Right. And that was 1984, if I'm doing my math right. And so we hear the stories then, and we say that was awful and tragic, but that was 1984. But, unfortunately, that exact story, I heard just last week. So we are making progress, but we still, and that's why your role in awareness has been so important, because we still have these, oh my goodness, stories. Why on earth is this 1984 story that you just shared still repeating itself in 2021? We've got to do better with that. So then we learn your LQT2. You mentioned your child, number 1. And so do we know, and now I know there's another one, a little 3-year-old lurking somewhere on the sofa. Were we able to learn and the status of the children by genetic testing to see who did and did not have it? And how are you doing?
Yeah, so thanks for asking. So I have 3 daughters. My oldest was genetically tested. We were waiting on my genetic testing to come back. She was around 1 when she was tested. She's negative. My middle daughter, Alana, your biggest fan, is positive. She is type 2. So she was tested with cord blood right at birth. And so at 2 months, she was put on betas, but she's been asymptomatic. And her QT interval has been fairly normal. Here and there at some, appointments, it'll be a little on the high side, but she just saw her local EP this morning and good to go. So, and my youngest does not have. So just one of my 3 daughters.
Okay, well, great. And as our audience knows, with a LQT2 positive mom, each of her 3 daughters, each had a flip a coin chance, heads yes, tails no. And thankfully, it was tails no twice. So we have Alana. Well, Danielle and Karen, I'm going to let you take a short little break while Aaron brings on our second guest, Becky, so that we can hear her story. And then I'll bring Danielle back on. And there's Becky. This is Becky, who has an incredible story and has been a wonderful volunteer to the SADS Foundation. And so, Becky, like Danielle and Karen, give us, our SADS Facebook Live community, a glimpse of your heart journey so far.
So my heart journey is as a heart mom. So my son, Cameron, who was a normal, healthy boy, he ended up in 2007. We went to go wake him up for school, and we found him dead in bed. Not knowing he was a normal, healthy boy. We didn't know there was anything wrong with him. We had no family history of anything. He went to bed as a normal kid, and he didn't wake up. We put together some pieces at that time. So I started CPR on my son, and paramedics arrived, the whole journey of hospitalization. But the thing that just kept coming up is, why did this happen? And I'm a nurse and my husband's a firefighter. And both of us couldn't even answer those questions, because we knew there couldn't be anything that was going on that, could cause this. So we were stumped. But it was the great people at the hospital who kept asking us what happened. And so what we found out was my husband was coming out of work, and he was coming home from the fire department. My youngest son, who was 4 at the time, opened the door, and our burglar alarm was on. So Cameron was sleeping. our burglar alarm went off. Normally, Cameron would be very upset because the burglar alarm went off because he didn't like the noises. And he didn't like the noises because 3 months prior to that, he was placed on Ritalin. And he had been put on Ritalin because, he was showing signs where he felt like he wasn't normal at school and wanted to be normal. And they don't do pre-screening for putting people on Ritalin. They don't do standardized EKGs. And then from the Ritalin, he was put on, he had an ear infection, so he was on Zithromax at the same time. So he was on Ritalin, Zithromax, and he was sleeping, which was bradycardic, and the burglar alarm went off. Wow. So
the perfect storm.
We identified after about 4 days of the hospitalization. So he was in a coma. Cameron had signs of obvious traumatic brain injury from anoxia, and he was the first child in our area. I'm in Rochester, New York. And he was placed under the hypothermia protocol or Arctic Sun. And so we call him a camsicle for a little while. And we finally identified that they were thinking he had long QT based on the storm of the bradycardia, the medications, as well as the sudden alarm that triggered the arrest. At that time in 2007, they only had a genetic test for 1 through 7. And so when we went through and, Cameron recovered, he did have an ICD placed immediately. He's been on beta blockers. He's had his 4th now device change, revision, and lead revision.
Wow.
But in 2000, he's a happy, healthy 20-year-old boy now. So I do want to tell you, he does have an anoxic brain injury that, frontal lobe damage, but he's a normal, healthy boy. He works, he goes to school, he drives a car. He's still
wonderful.
A normal boy. But we did find out that our first initial genetic screening was negative for anything. We had mutations noted. However, 3 years after that, we were able to participate in another genetic study where they identified long QT 8 through 12. And it was identified that Cameron had long QT 8, which at that time, and thanks to you, were a pivotal person to identify that long QT 8 was a disease-causing mutation because our son did not have Timothy syndrome. So thanks to the SADS Foundation, for me, how I got involved with it was there was nobody in my area, and me as a nurse, I knew about long QT, but it was only about medications, and I didn't really know what to do. I had nobody around me to help support. None of the team of doctors really kind of knew what was going on. We didn't have a pediatric EP doctor in Rochester. So they were instrumental in helping me understand and start the journey of educating the public, as well as our healthcare practitioners in Rochester and across Western New York about long QT, about pre-EKG screening prior to specific, some certain medications, specifically in boys with ADHD. I started doing a lot of that, and it was this SADS Foundation was just the beginning of helping me to help the public. So that's our journey.
Becky, thank you, and give a big hello to Cameron.
I will.
Me and I know that when the Camsicle thawed out, a wonderful boy returned, and now a wonderful adolescent and a young man. And Becky, if you want to share, was it able to be established whether his LQT8 causative variant came from either you or his dad, or was there a family story, or did it start new in Cameron?
So it started technically new in Cameron. So Cameron was the first identified person that this had happened to. However, going back and doing the genetic testing, so all of the 4 of us So my husband, myself, Cameron was the first one that identified, and then our son Zachary, who's 17. We identified that Mark had the gene. And then, so we went through my husband's family. And so Mark had the gene, his father had the gene. Two of his father's sisters, one had the gene. And the one sister that had the gene, her son suddenly died at age 24 from what they thought was either an asthma attack or some sort of drug-induced, issue. But it come to find out when we started investigating more, he was using Afrin quite a bit for his allergies and asthma. And as we know, he was also on some other medications that could induce long QT if you had it. So unfortunately, we can't do testing back from that long. But we're pretty convinced, and all the doctors are convinced, that that was the start of our long QT journey. And what we identified is Cameron is genotype positive and phenotype positive, but the rest of the family is phenotype negative. So they do not have the disease causing. And Cameron's been in several studies at Harvard and throughout doing some tissues with Mark and himself to identify what was the trigger for Cameron versus the rest of the family in an identical match with specific long QT8.
Yeah. Well, Becky, thank you. And I'm going to have you stay here.
Okay.
And Erin is going to bring back on Danielle and her stepmom, Karen. And we're going to shift now our conversation for the rest of our time to not just your own personal story, but what has been sort of your agenda as a volunteer to sort of make a difference so that we kind of hopefully can bring an end to a 1984 tragic death of a mom with leaving her 3-month-old baby, and Becky's family, where there's these surprise attacks that come from a perfect storm aligning. And so as National Heart Month is now almost halfway, give us a sense, Daniel, since for the last years or whatever time frame you want, to tell us what you and your family have been doing to increase awareness about SADS-related conditions or genetic heart diseases that increase risk for the possibility of sudden death.
Yeah, absolutely. So, I mean, I would say for me, it started just right within my family because I just wanted to make sure the awareness kind of got out there. People were getting tested. They were getting those ECGs, everything like that. It started there. And then it started as simple as just sharing, in social media, sharing SADS posts, things like that. Right now, due to the pandemic, we had to cancel a fundraiser that we were hoping to have annually. We did have a fundraiser, which I felt like for me, I wanted to raise funds for the SADS Foundation, but it was just amazing the amount of awareness that came out of it, because what I saw is not only, say, people from my work, people from my mom's work, people from my dad's job, just family, friends, second, third cousins I hadn't seen in years, but who had, were close to my mom, coming together. And so I just plastered that event with facts about SADS and how to, all that information. Had a bunch of red kits available. I was making sure everyone took them with them.
Wow.
Things like that. Right now also it just becomes for me as simple as asking the question. I have 3 kids, meaning that there's a lot of moms that I'm really good friends with, just kind of that community. So their kids are playing sports, and I'm like, oh, they get their sports physical. I'm like, do they do any KG? Well, no. Is that something? What? And so, just kind of pushing it to that. I'm like, oh, you should get one. Well, they didn't do it. I'm like, you should go ahead and get one. Like, you really need to.
Danielle, you mentioned a SAD. Danielle, you mentioned a SAD red kit.
Yeah.
What is that?
Yeah, so the red kits are amazing. And I'm going to remember what's in them, but we have there's pamphlets in there. I'm just kind of going over SADS conditions. There's posters, kind of warning signs, things that you should look out for. Do you have any of these signs? Like so little posters, also those little bracelets that you can wear, which I found are a huge conversation starter. My kids all wear them. I wear them. What's that for? Just the conversation starter. Hey, you know what this is?
When you've given out those warning signs, some of the big ones that we want everybody out there, whether it's a frontline school nurse or whether it's a general warning sign awareness month, is number one, have you ever fainted suddenly or unexpectedly, like instantaneously fast faint in the setting of exercise or an auditory signal and a burglar alarm? Not the woozy faint. So we don't want to have an awareness program of, have you ever fainted, as a 1-800-FAINT sign, because fainting itself is incredibly common. 25% of all humans will faint at least once before their 25th birthday. But in the red kit, we talk about a specific faint. We talk about the danger faint, don't we? The sudden minimum warning faint during exercise or an auditory signal or an alarm clock, like an alarm clock, or in particular settings, being 3 months postpartum and suddenly fainting. So we try to make sure in our warning that there's the danger faint that we make people aware of. And then, sort of like Becky did, know your family history. Is there anybody that you're related to who's died suddenly or unexpectedly before the age of 40? Oh yeah, tell me about it. And we ask physicians and nurses not to just say, okay, the answer was yes, but tell me about that death. And then we can quickly figure out, oh, that death was sudden, but it wasn't unexplained at all. The revolver, had something to do with it. But forcing ourselves, right, to ask the question, is there any story, and then systematically get the details about every potential sudden death that has occurred in the family. And Becky, you've done the same thing with your volunteerism, but what has been your specific, agenda, if you will?
So ours took a little bit of a different turn. I mean, our advocating, when we didn't have anybody locally, and, as a nurse, my whole thing is I'm a nurse educator. I'm a master's prepared nurse. I educate. That's what I do. And I felt like I needed to educate everyone. And so I wasn't afraid to, make those phone calls. And the first thing I wanted, we started doing a couple things, but the first one is we wanted to give back to our local community and help the kids that, that needed it. So we did, the first 5 years, we did a lot of fundraising for our local hospitals. We did them for SADS, but we did fundraisers specific for like birthdays and, donating gifts and kids. And then I took it to the next level where I started finding more and more through the SADS Foundation, through, being an ambassador, through those things. I found a lot of local people who didn't have anybody as well to talk to. So we started the SADS West Rochester, Western New York, with the thanks of Alice and her team, were able to provide us with the use of, the SADS and representing SADS. We were able to do a support group and started doing that within our community. Had a bunch of events for that. And then it morphed into, okay, so we've got these teens, we've got these people. Now I want to educate the community. So I started with our local school. And in 2014, we trained 6,000 kids in CPR. And so we took it from there to then going to other schools and teaching them how to do that. All of our schools became heart safe schools. And then I started branching out to other schools. And then I started going community level to say, okay, I'm not going to end there. I'm a certified CPR and ACLS through American Heart Association. I'm going to donate my time, and I do mass CPR events. And I do them in my hospital. So where I work, we also do for Nurses Week every year, we do a mass CPR community event where we not only help the community learn CPR, but we also offer things about SADS conditions, hypertension, all the other healthcare related, diseases and states. And then my husband and I decided we needed to do something for our families who can't afford an AED. So we started doing an AED loaner program. So we have currently 32 AEDs that we've purchased. Some have been from generous donations that we buy AEDs. And then I work with our University of Rochester, with the physicians there, and they contact me when there's a family in need who's a bridge to therapy. So whether they're medication, AICD. So I provide them an AED, CPR training and support. And then until either insurance comes through, or if it's been greater than a year, I just give them the AED. So that's kind of our give back to our community, and also a thank you for having the gift of my son's life, that we give back and say, you know what, we were given a gift. We were able to get this AED, which was a great support for us. I want to give it back. So my husband and I try to buy 5 a year and keep them in circulation. And I've hooked up with a vendor who gives me the AEDs at cost and the device patches and all that at cost, so I can keep up my maintenance.
Wow. Well, Becky,
so that's what we do.
Congrats on what you and your family have done, and very fortunate. They're very fortunate. My good friend and colleague and pediatric heart rhythm specialist, Dr. Jeffrey
Vinoker, my buddy.
Yeah, and they're lucky in Rochester, New York, to have you for this kind of advocacy. For those out there in the United States who don't have a sort of an AED give back person, we have partnered with a wonderful organization called LifeSure.
Yep, and LifeSure has been the one that does the insurance for us. So
yeah. And they have done an amazing job, and our batting average at getting an external defibrillator for my patients who come from all over the country and world, they help us secure one for these families. I would say their batting average is at least 90-95%.
Yes.
So wonderful what you're doing. In our remaining minutes that we have, Danielle and Karen, as you look into the future, and you said, this is what we've been about. What's, if you would be like the one big thing? So there's this great guy on ESPN. He starts the morning or midnight or whenever his show is with the one big thing. So what's the one big thing or the one big gap that needs to be filled by the SADS Foundation yet to be pleasing to you, Danielle and Karen? If you said, here's, put SADS Foundation, put some energy into this and filling this gap.
That's a hard question, because I think what you guys are doing is so amazing. It's a really hard question. I don't know that I can answer that specifically. Do you?
Many needs, and I know that SADS Foundation is doing all they can, all you can to fill that. I mean, definitely the school sports thing. I mean, just lots more. Yeah. That's from way back when I was first in 2003 getting information. I was getting a version of the red, what do you call it, the red pack?
Yeah, the red kit.
The red kit at that time that I used as a dental hygienist with some of my patients who would come in and they would tell me about their issues, and it was kind of, I was able to pass along those brochures, and I also passed them along to school nurses and so on in the area. Well, at that time in 2003, they didn't
No one cares.
they didn't want to hear about it. So they're more open now. So
Right.
it's kind of baby steps, but I would keep chipping away at that.
When you think, Karen, of 2003 and 2021, are you pleased with the progress that's been made these past 18 years?
Oh, yes. Oh, yes. Very much so. What a difference. Like
Yeah.
I said, back then, there was one expert that we know of at that time.
Dr. Moss.
Dr. Moss. Arthur Moss. And so
In Rochester.
and he was the only one that we heard, and what I had access to was his papers. Well, I couldn't make heads or tails of those, but thankfully SADS Foundation, even then, and I know it was just in its infancy at that time, was just a great source of support. I didn't feel alone. I knew, this kid, that there was other people she could identify with and so on. So it's it's just come so far.
And I'll add from a mom's perspective too. So just in 12 years, I had my first daughter 12 years ago. My last daughter is just barely 3. When I had my 12-year-old, they were so scared and didn't know what to do with me. They said I had to have a C-section because I was just too, well, luckily,
Right.
God had other plans, and those plans were for me to just have a really quick birth, and they didn't have time to do a C-section. But my baby, I was whisked away to a cardiac unit where my baby wasn't allowed, and she was taken from me immediately.
Wow.
And I didn't get to see her for a really long time because they had to wait for someone to travel hours with a machine to read it was, that doesn't happen now.
Right.
It was like, so the difference just between daughter number 1 and that SADS has given me the tools to advocate for myself. So I can say, this is what we're going to do because I, have the information and the tools, and I have the amazing support of my providers.
Well, Danielle, I'm going to give you an assignment potentially, because while I'm going to turn my attention to Becky for her final thoughts, here's your assignment, Danielle. Normally at the end of the program, I show a picture of my granddaughter. But if you're able to get into your smartphone to find that picture of your daughter and me at that banquet, I did a quick search and I wasn't finding it. That's why my eyes were glancing down. But I'd like to end the program after I talk with Becky with you showing that picture of your precious little girl.
I can find it.
Okay, I'll let you be looking.
I'll look while you.
And Becky, with all that you did, immediately you said, I'm going to get my family cared for. Then I'm going to get my children's school system cared for. And then I'm going to get my community cared for. And now I'm going to get most of the state of, or at least the western area of New York. Gap. What's the one big thing that if we at SADS had unlimited resources, that you'd be saying, we still need to address this issue. I'm not pleased. I'm not satisfied with where we are in 2021 yet.
I mean, so it's been hard because I've advocated in the legislation. I've gone to New York State. I've gone to Albany. I've gone to our senators. I still am seeing stories of sudden death during sports. I am still seeing those, especially now with COVID. I'm glad that they put those requirements in, for kids with, because of the heart effects that could be happening at post-COVID. But I still don't believe that our community and our schools, sports aren't looking at, yes, it's just that little 1% potentially, but for any family, that 1% is way bigger. If we had done an EKG prior to Cameron going on medications, he never would have suffered a cardiac arrest. It would have been identified that he had long QT at that time. I know the Pediatric Association, but I think that we could still do a lot more, especially with children going on specific medications, as well as teenage girls. The ideas of them fainting and, it's your hormones, or, we've had 4 cases in the last 2 years of female athletes who have dropped during sports and had either an AED provided or had been placed on ice and popped out, and they've identified that either have CPVT, they have some sort of, endocarditis or some sort of heart arrhythmias, as well as long QT. So I think that that's a harder one to go by, but I still am a huge proponent of our is advocating a little bit more with more questioning and looking back at family history and really identifying about the feigning, like you said. I don't know if it's really taken seriously enough.
Right. Well, Becky, thanks a lot for that. And I know, stay tuned, everyone. The paper that we just published last week in Circulation is going to be the QTC pivot paper. We will never, once we get FDA clearance, and we're 1 week closer, it's going to be a while yet. But once that happens, we won't be doing the QTC like we've been doing it since Eindhoven, which has been over a century now. That will open up a whole new possibility to screening for the early detection of long QT syndrome. And I think we'll look back at 2021 as the year in which we finally can do long QT syndrome screening. And then gradually we will get adoption of that. And eventually we'll get societies like the American Academy of Pediatric endorsing it. But I don't need AAP's endorsement for us to begin to do it once this rolls out.
That's amazing.
Long QT syndrome is a highly treatable condition, as we know, when we know it's there. Tragedies don't happen almost ever when we know it's there.
Right.
And we're getting closer and closer, and we're getting closer to days like that because of Danielle, you and Karen, and because of Becky, you and your husband and your advocacy. And I thank you all. And to close out this Friday, Danielle, what do you have to show us?
I have two pictures I found. So I wanted to highlight this one. Let me see. Oh, no. Hold on. There it is. Ready, wait, that way. Okay. So this was a picture that was painted for Beyond the Diagnosis. And so that is at the SADS Foundation or SADS conference in Georgia. And that's my daughter Alana. And then I do have one other here that's a sweet one.
Oh. Well, on that note, we can't end any better than that with a complete joy and beauty in your daughter. So both of you, all three of you, thanks for giving your time today. And for our folks and families and friends out on SADS Facebook Live land, whether you've been watching live or you'll watch this in the future, thanks so much for joining us today. And come back next Friday, same time, same channel. You're going to really enjoy my conversation about the correct investigation after a sudden cardiac arrest. What's the right way to do that evaluation for the survivor and for the sudden cardiac arrest survivors' families? And I'm hoping that I'll have both Arthur Wilde from Amsterdam and Martin Stiles from Down Under, but that means he has to get up at 5 a.m. Saturday. So Martin, if you're out there, set your alarm early and join us next week. So hope you all can join us next Friday. Until then, have a wonderful weekend, everyone. Thank you.
Thank you.
Thank you.